Well, hello again. Um, Seeing as this is the first official segment of talk therapy with Gabby, I figured that I kind of want to stay close to the theme of therapy, psychiatry, psychology, all of the above, and talk a little bit about my experience within mental health, the mental health arena, and being a client, being on the client end of care, what my experience has been with different providers and different services. So I think it's a little bit of a dry topic, but there's actually many instances that I'm sure you guys will find interesting in terms of what I've been through and what I've heard, what I've been told, both positive and negative. I've had really great experiences with mental health care professionals, and I've had really big letdowns as well. And I think I'm going to start with the positive experience because actually that did chronologically occur first. And I'm going to leave names out because I don't want to offend anyone. But maybe I can just use like a pseudonym, I guess, or like kind of like a nickname. I at the time lived in the Hartford area. I found a really great therapist through a public behavioral health clinic, which was covered by my insurance. The lady was freaking awesome as a human being and as a clinician. She actually took the time to listen to what I was telling her, what my problems that I was dealing with, very real situations that were inexplicably hard to explain to just any old person because they detailed, generational trauma, family loss, mental health crises in a row, and just a lot of difficult topics. But this lady actually made me feel like I was talking about the most obvious and simple thing to understand. She not once made me feel like I was talking jargon, like I was crazy, like I was talking in circles, or that what I was saying didn't make any sense. As soon as I was kind of wrapped up explaining my situation, my personal situation to her, she totally got it. And from that point forward, we were friends. And I can honestly say she was a good friend that I went to go see every week or every other week, depending on schedules and stuff, for almost 3 years, which is the longest I've ever had one single therapist. And unfortunately, she got reassigned, or rather, I got reassigned. They shifted, the whole network got shifted, and they broke us apart. The people in charge of that clinic came in and redistributed all the clients they had all new personnel, all new clinicians. And after that, and since then, I have yet to find another therapist, social worker, anybody that matched her genuine empathy, ability to listen, and her connectivity. She was I just really felt like there was someone there for me. A very amazing lady. And I still think about her. And unfortunately, like I say, it hasn't come around again. And following that, I've had a number of disappointing experiences. And I am not trying to be a cynic, but when I say that my negative experiences far outweigh the positive ones, it's a sad fact. And I think it has to do with people not living their full potential. You know, people who work in healthcare, in mental health, in behavioral health, who become clinicians and social workers and nurses and whatnot, I think they are just people too, and they get worn down. They forget why they ever got into it in the first place, if there was ever really even a genuine reason other than an easy paycheck or what seemed to them an easy paycheck. There's just so many moments that I can recall that I just felt dismissed. I just felt unheard. That there was nobody on the other end picking up the line. And when you're reaching out for help and you're going to a place like a behavioral health clinic and that's the response you get, it can be very defeating. It can feel very depressing. And so that was quite unpleasant. And I always kind of wander off after an experience like that, scratching my head, thinking, why did that person get into this line of work? Don't they understand the importance of the role they play? I mean, they're essentially in the position to potentially save lives. Because there's people going there who are using drug abusers, regular drug abusers. There are people there that are extremely depressed, that are contemplating suicide. So there's all sorts of scenarios that come to mind where being an outreach worker or a care worker or whatever, even a therapist, your role and your assignment in that position is extremely valuable and important. And the choices that you make and the way that you offer your assistance and your presence to people, it can really alter the outcome in a big way. And I just am always aghast to see how undervalued and unappreciated and just, I guess, misunderstood some people can be. But so anyway, I don't really want to name a specific negative experience, but I will go on to say that if you are a person who is kind of struggling and you're reaching out and you feel like you're not finding any help out there, just know that you're not doing anything wrong. And those people that are supposed to pick up the phone and be there for you, or offer you a helping hand, or lend you an ear or a shoulder to cry on, those people get paid. They get paid. They make a living. They're supposed to be helpful, decent, committed type people. But unfortunately, we don't live in a perfect world. And if you're not getting that kind of reaction or that kind of assistance or help that you're seeking and needing, you're not doing anything wrong. It happens way too much. And you have to know you are not the problem. They are. It's sad but true. A lot of people just go to work for the paycheck and they couldn't care less. You know, they're in their mind, it's like, the less I have to do and the less I have to deal with and the less I have to speak and the less I have to be involved, the better. But unfortunately, it's not true. Because people, when you're in that line of work, people are depending on you. And it's not okay to shrug it off and act like you know, I mean, even if you're working at McDonald's and you're working the drive-thru and you decide, oh, I just don't feel like handing out fries today, you'd lose your job. And yet these individuals working in offices and in the healthcare field, and it's very hard to gauge the level of services and the level of effort that is being given. So I think that's part of the problem, is that it's very hard to tell if somebody is not being completely effective, because they will try to cover it up. They'll say, oh, it was a slow day, not that many people called, or not that many people asked questions or came in. And who's going to know the difference, right? If they just send you back out the door. Now, actually, I do want to share one little anecdote, and then I have to wrap it up. But along the same line of thought, I had what was her name? Peer support counselor, I believe was her title. She was in recovery herself. Her job was to basically be my coach and guide me to stay clean, sober, and maintain a healthy level of sobriety, and continue checking in for my appointments and stuff. So she did do that to a certain extent, but I have to say it got very strange at one point. She became forward and competitive towards me, with me. And it was to the point, like, at first I thought, I'm like, I have to be imagining this, what is going on? This doesn't make any sense. I mean, this girl and I have had this professional type of connection for like 2 years now, and now out of the blue, she's acting some kind of way. And, I tried to understand where she was coming from, but to be honest, I really couldn't, because in my eyes, the way she was acting was kind of very aloof and in my eyes kind of dirty, despicable, because it's your job to set an example. And I think setting a tone of unhealthy competition with your client is toxic. It's not going to promote any kind of well-being or anything. So right there, I felt like the whole friendship, so to speak, that I had built with her over the course of 2 years was a complete fraud when she started acting that way towards me. And it really kind of hurt, because I had very few people in my life, even then, that I could really count on, check in with, talk to. And I felt that she made a mockery out of the whole thing. It made me feel very diminished and just plain crappy. So I guess the moral of the story is, if you are that person, if you are supposed to be encouraging somebody, even if it's not technically your title, even if it's not your job that you're getting paid for, even if you're just somebody that has kind of taken an oath or taken on the role or responsibility of, helping your friend stay sober, or guiding somebody along, or whatever you want to call it, please do not mess with that person's head. It's not a nice thing to do. When someone is coming through recovery and they already have issues with trust, they already have issues with depression, they probably already have issues of being rejected or whatever it may be, the last thing they need is for you to push them away or make them feel bad or put them down, or make them look at you like you're less than worthy. You know what I mean? So anyhow, if you are that person and you're in the role of being the leader, please keep in mind that that person is in a kind of a delicate limbo state, and they need your encouragement. They need you to have faith in them. They need you to see the best in them. And while that's not necessarily a, how do I say, a given, I mean, you can say that you might have to earn it. You might have to earn that from me, and that's reasonable and it's fine. But just try to be mindful of the way in which you set up those encounters and create those types of dynamics with that person. I hope that makes sense. I feel like that's a great message that I really feel good about getting across, because it really can apply to a lot of people. Like over half of the people that I know currently are drug or alcohol abusers full time. And then like the rest of the people that are just normal working people are kind of just going along doing their thing. And what I'm seeing is there's like this big divide. And what I'm not seeing is hands reaching out to hands and people offering advice or guidance. And I think basically it's a lack of trust, and both sides are hesitant because nobody wants to get hurt. Nobody wants to have their trust broken. Nobody wants to be disappointed in the other person. And yes, it can be a very difficult bridge to build and a difficult path to follow. But I think that if there were more partnerships like that, and if there were more hands reaching out, to offer that type of guidance, I think things would be looking a lot different in our lives. Freedom is great, and thank God for free will. We all make our decisions as adults. We are entitled to do however we please, and that's wonderful. It can be wonderful. It can be a beautiful blessing. But at some point, I think when there's a lack of common sense, and there's a lack of concern for basic health, safety, basic things of self-care, I think that intervention is entirely the best approach, because that person needs to hear it. Whether they seem like it or not, that person needs to hear. They need to hear, hey, are you okay? Can I help you in some way? And yes, it's a risk to reach out that hand. And I think you have to do it in a very smart way. You have to keep your boundaries intact. It's not an invitation to be walked on or taken advantage of. You're not offering them money, or you're not offering them necessarily, you don't want to become their crutch, but you just want to let that individual know that there are options and there are people who are willing to walk alongside them for a little while and talk about things and figure things out, because sometimes people get stuck, because sometimes they haven't seen any other options, or they forget, or it's been a while, or they just don't know where else to look. So it can be an amazing thing to be that person who is willing to take a little bit of that risk in a very safe and defensive way, to say, hey, if you're not okay, or if you feel like you need a change, or you want to start doing things different, or you want to figure out what other options you might have, talk to me. I might be able to help you out with that, or I might know someone who can help you out with that, or maybe we can figure it out together. Okay, well, my time is way past up. I've taken up 20 minutes of your precious time and mine. I hope that you got something out of it. I hope that that you'll want to come back for another session. This has been Talk Therapy with Gabby. Hope to see you soon.